Allah be praised. Ladies and gentlemen, today marks an important occasion, the launch of the National Nutrition Survey Report, the culmination of 2 years of coordinated, concerted effort undertaken by the Ministry of National Health Services, Regulations and Coordination in collaboration with the provincial health departments and with the support of partners, the Khan University, UNICEF and DFID. Insights from the survey would help develop evidence-based initiatives.
There is no question that extreme poverty and food insecurity are intertwined in Pakistan. And this requires targeting by our social sector and our social transfer schemes. So I'm very supportive of targeting our existing social transfer schemes, the income support program, to addressing the extreme poor and the extremely food insecure districts. This is one vehicle of doing so. We could do it by, we'll discuss tomorrow how that can be done in a perhaps more evidence-based way. The third important point, which I'm counting on our minister to enforce to our parliamentarians and our prime minister, is that in Pakistan, we actually have a triple burden of malnutrition. And they all have equal costs. There's undernutrition, there is emergence of obesity and overweight, and there is ubiquitous micronutrient deficiencies. These three are intertwined, and therefore, they require a holistic nutrition program to build Pakistan's human capital. We cannot build our human capital on just undernutrition investments. You would have to invest across the entire continuum. The third is that you have enough data. This is the third sequential nutrition survey that my team has undertaken since 2001. 20 years on almost, I can tell you, I don't want to do any more surveys. I think we've got enough information, enough granular information now for policy. What we need is action. Hopefully we have the political will, but we not only need the political will at the federal level, I'd like to see the political will at the provincial level in terms of addressing this. The second set of conclusions is, what I've already mentioned, is social protection targeting. Others require a massive investment in cleaning up our environment. I'm convinced that by just focusing on improved water, we're not going to be able to get clean water or safe water to our population. We need to really do something better, much better. Those of us who drink out of these bottled waters don't realize what it's like to live in rural populations where you have not even access to boiling water. So this needs to be done by enhancing sanitation as well as water. Third point that I've missed is invest in your young people. And young people are not just those starting at 10 years of age. I think we have missed the opportunity of influencing health, education, empowerment, life skills in school-age populations. Pakistan desperately needs this with better information and development of evidence-based programs. And this point is critical. I don't think we can get anywhere with addressing nutrition in Pakistan without improving women's empowerment, without ensuring, as I've told you, that we must eliminate underage marriages. We must promote family planning to reduce family size and increase inter-pregnancy intervals. There is nothing wrong with this. If we improve our breastfeeding rates, you probably can do it just by natural family planning. But this is something that we need to focus on in terms of doing in Pakistan, and I know that this is close to the government's heart. My third final set of conclusions is that we need a nutrition action plan. Now, it would be a surprise perhaps to our Minister Saab that Pakistan never developed a national nutrition strategy. My first efforts at trying to do this were in partnership with UNICEF in the year 2001, at the time of the first nutrition survey. It died its death in the Planning Commission. I made something like half a dozen presentations, and then they could not get a consensus around what we needed to do. Now we have provincial strategies, but we don't have a national nutrition action plan that we need. And Basir, this is a challenge to you to make sure that these data can be used for developing something that we can align on. The key interventions at primary care level are clear. I've mentioned them around breastfeeding, complementary feeding, and focusing on high-risk districts. We also need to couple this with developing our human resources. Minister, Pakistan does not have a single nutrition center of excellence. A country of 205 million people does not have a single human nutrition center of excellence. There are some university departments, but there is nothing like a national center of excellence for nutrition. And it's not only because the NIH director is sitting here, but I think we need a center that can be the focal point for monitoring, training, but it needs to be done in very close consorts with our academic sector, Higher Education Commission, and the Ministry of Health Services and Regulation. And lastly, monitoring and evaluation system. We should not have to depend upon these surveys every 5 years, spending millions of dollars and spending time and effort. We should have a routine information system that we have, which should target towards collection of nutrition data. Just like you're trying to do with health systems, we should have a vibrant information mechanism to allow us to measure and monitor this on a real-time basis. So I want to close with a quotation from one of my favorite public health leaders. And can you go to the next slide, please? And I know that our honorable minister has worked with her as well. Can you go to the next slide, please? I can't move it. Yep. So this is Gro Harlem Brundtland, the former Director General of WHO, former Prime Minister of Norway. And she made this statement at a meeting that I was at also, and it's forever been burnt in my memory. But what she said was the dual scourge of hunger and malnutrition will be truly vanquished not only when our granaries are full, but when people's basic health needs are met and women are given their rightful role in societies. Thank you very much for your attention.
Thank you, Professor Bhutta, for presenting the key findings of the survey. All of you have this triangular leaflet in front of you. You could adopt the three-step procedure to get the NNS key findings on your smartphone. All you have to do is to go to the App Store, download the QR code from the App Store, and when you open the QR code, you open the camera, place it in front of this NNS apple, and you can go to the link of the NNS key findings. That was just presented by Professor Bhutta. Now we move on. Next, I request the UNICEF country representative, Aida Girma Milaku, to share her thoughts. Thank you.
Thank you. I think it's going to be very difficult to follow Professor Bhutta. Honorable Minister of State for National Health Services Regulation, Dr. Zafar Mirza, the Federal Secretary of Health, the Director General of Health, Professor Bhutta from the Aga Khan University, and other researchers who have contributed to the National Nutrition Survey, the Country Director of DFID, members of the international donor community, UN colleagues who are here, distinguished guests, ladies and gentlemen. Let me begin by congratulating all in the nutrition community, and in particular those who have contributed in collecting and analyzing data and compiling the results of the National Nutrition Survey. Indeed, this is a commendable achievement, and credit goes to the government for providing the leadership throughout the planning and execution of the survey. The high level of malnutrition in the country is an issue which the Prime Minister of Pakistan had repeatedly highlighted as an issue to be addressed as a national priority. The 2008 National Nutrition Survey results provide baseline on the nutrition status of the country and evidence to inform policies and decisions to address the underlying causes of malnutrition. The National Nutrition Survey is a wake-up call to a clear and present emergency. High prevalence of various forms of malnutrition affecting vulnerable groups is more responsible for the ill health of the people of Pakistan than any other cause. In Pakistan, 4 out of every 10 children under 5 years of age are stunted, as we have just seen. An estimated 5 million children suffer from wasting every year. And we now know that the child with severe wasting is 8 to 9 times more at risk of dying than his well-nourished peers. Over half of the population in the country is anemic. 1 in 8 adolescent girls and 1 in 5 adolescent boys suffer from being underweight. At the same time, prevalence of overweight among young children and adolescents is alarming. Besides being a public health issue, the observed level of malnutrition is a major constraint to socioeconomic development. According to the World Food Programme, it could cost Pakistan up to $7.6 billion annually if immediate and remedial measures are not taken. This year, the world commemorates the 30th anniversary of the Convention on the Rights of the Child, to which Pakistan is a signatory. It is all the more important to reiterate that malnutrition is a violation of children's and adolescents' rights to survival and development. Child undernutrition is caused not just by the lack of adequate nutritious food, as we have seen from the conceptual framework, but also by frequent illnesses, poor care practices, and lack of access to health and other social services. Adequate nutrition, therefore, requires interventions that go beyond the health sector. Access to adequate nutritious food, clean drinking water, sanitation and hygiene, maternal, adolescent, and child health services, social protection schemes for those living below poverty line, nurturing and care and positive parenting to promote holistic development of the child. All of this play an integral role in keeping children healthy and protecting them from life-threatening illnesses. Ladies and gentlemen, it is imperative for us to understand that throughout childhood, good nutrition is key in keeping children strong and healthy. The developmental impact of stunting and other forms of undernutrition occurs early and is greater than previously thought. The first 1,000 days of life, that is the period between the start of a woman's pregnancy and the child's second birthday, offer an extraordinary window of opportunity for preventing undernutrition and its consequences. Now that we have fresh evidence, the overarching priority for government and all of us partners should be to ensure a multi-sectoral approach that is taken to deliver a comprehensive package of nutrition-specific and nutrition-sensitive interventions at scale, with quality focusing on the first 1,000 days of life. And to accelerate the results, and I think this has been mentioned already, we need to strengthen multi-sectoral coordination of nutrition interventions, invest in health system strengthening, and particularly the primary healthcare system, because a lot of the nutrition-specific interventions can be delivered at scale using the primary healthcare system. We need to support and scale up food fortification at large scale, make the social protection system work and make sure that it's nutrition sensitive, and nutrition information system, so that we now have data by district, very credible data that we can use to measure performance at district level and make sure that there's accountability for results strengthened at all levels of the system. We also need to make sure that no child is left behind. We must work together on all fronts, including food security, gender parity, access to clean water, all of that without making sure that every child is reached. SDG 2, or zero hunger goal, can only be achieved if no child, woman or man is left behind, regardless of how difficult and challenging the circumstances are. Honorable Minister, ladies and gentlemen, I wish to assure you of UNICEF's commitment to continue to work with the government and its partners at all levels to accelerate results in nutrition. In doing so, we will use our extensive global expertise in nutrition and our strong field presence, leverage our support in other sectors, WASH, health, and other social sectors. All of this we can actually leverage and use to accelerate results in nutrition. Last but not least, I would like to acknowledge our key partners, the United Kingdom DFID, the Aga Khan University, our UN colleagues, and all other partners with whom we have been working to make this NNS possible. Once again, I extend our sincere appreciation to the government of Pakistan, particularly to the Ministry of Health and the provincial governments for their commitment to addressing the issue of nutrition, which is fundamental to the welfare of the child, by investing and compiling and analyzing this baseline data as the National Nutrition Survey of 2018. I thank you for your attention.
Thank you, Madam. It is now my pleasure to invite Ms. Joanna Reid, the head of DFID office in Pakistan, for her remarks. Thank you.
Thank you very much. I'm similarly daunted to think how I can say anything new or different and after such eloquent speakers, but I'll have a go. Honourable Minister, Secretary, distinguished representatives of the government, development partners, ladies, gentlemen, and as I look around, colleagues and friends, good afternoon. I'm delighted to be here this afternoon to officially announce the results of the 2018 National Nutrition Survey. And firstly, I would like to thank the Minister of Health for chairing this launch. It sends a very strong signal about the high level of political commitment there is to addressing malnutrition in Pakistan. And I have to say that one thing I have seen consistently in my time here in Pakistan and respect greatly is that the government is not afraid to collect and to share data, even when it's not necessarily telling a good story. And the government's commitment to taking action is shared by the UK government. Preventing and reducing malnutrition saves lives, reduces illnesses, enables children to learn, and helps individuals and countries escape poverty and maximise their potential. And that's why the UK government made a global commitment to improve nutrition for 50 million women and children by 2020. So we've been hearing that malnutrition is a major challenge to human development and economic growth. Poor nutrition in childhood has profound effects on immunity, growth and brain development. And children who are malnourished are more prone to infections, less able to learn. As they grow up in turn, they're less able to work and support their families. Women who are malnourished are more likely to have malnourished babies. And we've heard about this multi-general cycle of malnutrition and poverty. Undernourished children then grow into adults vulnerable to non-communicable disease as well as communicable disease. So countries face a double burden. And we've already heard the exhortation to invest in young people. This survey is the result of a partnership, and I would also like to thank the Aga Khan University for implementing the survey, the Ministry of National Health Services Regulation and Coordination, and UNICEF for their strong leadership and oversight. And we've heard about the other partners who have taken part, including at provincial level. I believe it's fair to say, and we saw the pictures, that the execution of this survey was not without its challenges, everything from difficult weather situation to security issues. But these obstacles were overcome, and this has produced the largest household survey ever conducted in Pakistan. And it's a real achievement that, unlike the 2011 nutrition survey, this one is representative at district level, just at provincial level, and it means we can much more accurately target interventions. And what's also exciting is that some of the new data is new data that's been collected. And this is complicated and it's taken me a bit of time to get my head around, but we've got biochemical data which assesses micronutrient deficiencies in women and children. We've got data on nutritional status of adolescents that we've heard about. And we've also got information on the underlying drivers of poor nutrition, such as water quality and sanitation we've heard about. But I'm particularly proud of the fact that the survey has collected data on child disability. And that's using the internationally recognised method developed by the Washington Group on Disability Statistics. And the survey has identified that overall 13% of children under 5 have at least one functional difficulty. That's shocking. That's the result of these statistics. DFID has consistently championed data on disability so that we can truly ensure that we leave no one behind, particularly those that are most vulnerable. We've also heard that gender issues are key to understanding malnutrition trends. Malnutrition is related to social culture factors, resulting in the systematic neglect of girls. And we know that that's reflected in the lack of educational opportunities, dropout rates, high rates of early marriage, and a general lack of female empowerment. And I'm going to come back to that at the end. So as I've said, the results of the survey are so sobering and in some cases shocking. And we've heard these results, but some of them bear repeating. It's only slightly good news that the national prevalence of stunting in children under 5 has gone down from 44% to 40%. The bad news is that acute malnutrition or wasting has increased from 15% in 2011 to 18%. 43% of women of reproductive age and over half of children under 5 are anemic. And the bit I really struggle with is this new information on overweight and obesity, that's increasing. So again, we've said it, but it bears repeating that Pakistan has this triple burden of malnutrition, high rates of undernutrition, micronutrient deficiencies, and obesity. And this burden is only going to get worse if urgent action is not taken. Global changes are putting pressure on food systems, and global drivers include population growth, urbanization, and climate change. We've all heard earlier this year the World Bank Pakistan at 100 report, and it's really forced us to sit up and think. And Aida and I have attended many events regarding that. But 3 of these are particularly relevant to Pakistan. The population of Pakistan is growing too fast. It's projected to be higher than 300 million by 2050. That means we'll have more mouths to feed and less land to grow food on. Secondly, the percentage of Pakistanis living in urban areas is projected to increase to 50% by 2050. And urban populations are more exposed to the kind of ultra-processed foods and non-traditional foods, particularly in the poorer areas, which are associated with poorer health and, yes, obesity. And thirdly, climate change will lead to a global fall in crop and livestock output. And we know that Pakistan is susceptible to climate-induced food insecurity. So, in short, more people, less land, tougher growing conditions will make the supply of safe, affordable and nutritious food a huge challenge for Pakistan. DFID is a strong partner in nutrition, and we're already working to improve diets and nutrition. Through our Supporting Nutrition in Pakistan programme, we're fortifying staple foods with essential micronutrients. And what's exciting about that programme is its scale. It can provide over 70% of the population with fortified edible oil and over 50 million people with fortified wheat flour. We've heard that poor sanitation is a driver of malnutrition, and we're working with the World Bank in Sindh supporting villages to become open defecation free. And our Prevention Health and Nutrition programme in Punjab and KP has increased the ability of primary, secondary level healthcare facilities to treat children who are malnourished. And recently, we've commissioned some new work to see how DFID Pakistan can support interventions across the food system to improve the availability, affordability and consumption of better diets. I said earlier that malnutrition is complicated, and it is. There's not one problem with a simple solution. And Professor Bhutta, you very much counselled against us believing any such thing. We need multi-sectoral action. The recent establishment of a monitoring cell in the Prime Minister's Secretariat is a welcome initiative to provide central oversight and leadership. So we will continue to work with the government of Pakistan and other development partners to expand our work on nutrition. Pakistan's future depends on tackling this crisis, and I'm proud of the contribution that the UK is making to support Pakistan in this effort. And I really like the quotation that you finished with, which finished with the point about empowering women. And personally, I agree that the biggest game changer of all would be empowering women. That will make a huge difference. So thank you all who have supported this survey, and I'm confident that the evidence generated will inform better nutrition programming and improve the lives of the poorest in Pakistan. We've heard a lot of serious things this afternoon, but just to raise the tone a little bit, as Sherlock Holmes has said, it's a capital mistake to theorise